Dear students, welcome back. In the previous session, we have discussed about ankle joint structure. Now in this session, we are going to discuss about ankle joint function, which includes axis of ankle joint and also the arthrokinematics and osteokinematics of the movements of the ankle joint. Now first we will see the axis. So this is the posterior view and this is the superior view of the foot here, and this is the posterior view of the ankle. In a neutral ankle position, the joint axis passes approximately through the fibular malleolus and the body of the talus here, and through or just below the tibial malleolus. This is the tibial malleolus and this one is the fibular malleolus, and this is the body of talus. So this red line indicates the axis of ankle joint. Okay, so again we will see. So the joint axis passes approximately through the fibular malleolus and the body of the talus and through or just below the tibial malleolus. This is the axis for ankle joint motions. The fibular malleolus and its associated fibular facet on the talus are located more distally as well as posteriorly than the tibial malleolus and its associated tibial facet. That means this fibular malleolus is placed somewhat posteriorly as well as distally when compared to the talus. So it appears in an oblique manner. Okay, yes. So in the superior view, we can see how this one is going, the axis, this red line. So that means here the fibular malleolus, that is lateral malleolus, which is placed somewhat posteriorly as well as distally, and tibial malleolus, that is medial malleolus, is placing somewhat anterior. So and this becomes the body of talus, which forms like this. So you can see this obliquity of the axis in the superior view. Okay, yes. Now, so the most posterior position of the fibular malleolus is due to the normal torsion. Why it is placed posteriorly means here, which is due to normal torsion or twist that exists in distal tibia in relation to the tibia's proximal plateau. So like we have seen some femoral torsion, isn't it? Like that here this tibia is also having some torsion distally in relation to the tibia's proximal plateau. So this tibial torsion, okay, or this is called as tibiofibular torsion because both the tibia and fibula are involved with the rotation in the transverse plane. And this tibial torsion accounts for the toe out position of foot. So that means toe out position of the foot in normal standing. Okay, so the torsion in the tibia is similar to the torsion which is found in the shaft of the femur, although normally which is in reversed in direction. So the amount of outward tibial torsion increases from birth until 10 years of age. As tibial torsion increases, the axis of the ankle joint is positioned more laterally in the transverse plane. Although variation exists and some of the clinical measures have reported values that approximate 90 degrees of lateral torsion for both male and female, and it has been noted larger values for tibial torsion which have been reported in studies that used in CT, that is computerized tomography. Okay. So the ankle joint classically is considered to have 1 degree of freedom with dorsiflexion and plantarflexion. So with this axis only 1 degree of movement is taking place, that is dorsiflexion and plantarflexion. So where this movement is taking place means between the talus and the mortise. Mortise we know. So this is the mortise. Okay. This is the mortise. So inside this mortise, the talus is articulating here. Okay. So what happens here? At the ankle, dorsiflexion refers to the motion of head of the talus, dorsally. Okay. Head of the talus dorsally, or upward we can say. So there is an upward movement of talus. Okay. So upward. And then if you see on the side way, which is very much clear. So that means here this is the actual talus. Okay. Talus is present. Over this you'll have this mortise, ankle joint. Okay. So that means here what is happening during ankle dorsiflexion, what is happening, foot will move like this. So dorsiflexion, foot will move like this means, so then what happens here, the ankle will move upwards. So first the head of the talus moves dorsally or upwards. So that means tilting here occurs, while the body of the talus moves posteriorly. So it moves upwards and body will move posteriorly in the mortise, inside the mortise. So this is taking place in the dorsiflexion. Whereas in the plantar flexion, what will happen, again the foot will come to normal like this. So then here whatever it is moved posteriorly, it has to come anteriorly. So the anterior tilting of the body and downward movement of the head of the talus is taking place. Okay. Because of the lower position of the fibular malleolus, the axis of ankle is inclined down on the lateral side. So this one is inclined down on the lateral side, and which is having an average of 14 degrees. So this one is an average of 14 degrees. However, the amount of inclination might be highly variable between the individuals. Okay. So these are the things we can see in related with this axis. Okay. Some of the studies have been done in a simple hinged model with a level indicator to demonstrate how an axis inclined more distally and more posteriorly on the lateral side will create a motion across 3 planes. Because of this inclination, it creates motion at 3 planes. So that this is called as triplanar motion. That means whenever these studies shows that dorsiflexion of the foot, because of this inclination of angle, dorsiflexion of the foot around a typically inclined ankle axis will not only bring the foot up but also simultaneously bring its lateral to the leg. So when dorsiflexion is taking place, so the leg will move towards the lateral side. The foot will move towards the lateral side of the leg and appear to turn the foot longitudinally away from the midline. So that means plantar, this thing is going to take place in the dorsiflexion. Whereas in the plantar flexion, what is happening here, so here the foot is going down foot is going down, and here the foot is moving medial to the leg, okay, and appearing to turn the foot longitudinally towards the midline. So here the foot during plantar flexion, all this will move like this. So that means here during this dorsiflexion and plantar flexion, again here some composite motions are taking place, okay, because of this inclination. But what happens means here, this variations, this composite movements will have very small degree of variation of movements can be observed, okay. So this is about this axis here, and if we will move on to the function, that is what are the type of movements, how much degree it is going to take place. As we know that it is having only 1 degree of freedom, and it shows plantar flexion and dorsiflexion here. So the primary motions allowed at the ankle joint are dorsiflexion and plantar flexion, and the normal range of motion for dorsiflexion is 20 degrees and 50 degrees for plantar flexion, okay, and 10 degrees of ankle dorsiflexion is considered the minimal amount needed to ambulate without any deviation. That means 10 degrees of dorsiflexion is enough for ambulation without any deviation. So but the normal range is 20 degrees, okay. During ankle joint dorsiflexion, plantar flexion, the shape of the body of talus facilitates joint stability, okay. So because of its shape of the body facilitates the joint stability. The trochlear surface of the talus is wider anteriorly when compared to the posteriorly. So when the foot is weight bearing, dorsiflexion occurs as tibia rotates over the talus. This is the orthokinematics, okay. The tibia rotates over the talus. As the tibia rotates over the talus, the concave tibiofibular segment slides forward on the trochlear surface of the talus. The wider anterior portion of the talus will wedge into the mortise. That means that anterior portion will fix into the mortise, separating the tibia and fibula to enhance stability of the ankle joint, okay. That means during weight bearing, what is happening, this tibia will move on the talus, and this talus is going to fix, the anterior part of the talus is fixed into this mortise and separating the tibia and fibula, okay, and which enhances the stability of the joint. When you compare the loose packed position of the ankle joint in plantar flexion, when the narrower posterior body, so this narrower posterior body, plantar flexion means like this downward move. So then what happened? Normally we have already discussed that the head and body of the talus will move downwards. Then what will happen? The posterior part will come upwards, which will mortise, which will make a wedge inside the mortise here. So then the ankle being less stable in the plantar flexion, so due to this less stability here, normally the pattern of injury to the lateral ankle ligaments are taking place in plantar flexion, okay. So the ability of the ankle to distribute weight bearing forces combined with mechanical properties of the tibio-talar articular cartilage reduces the risk of osteoarthritis at talocrural joint. Okay. In fact, post-traumatic arthritis is the most common type of arthritis occurring in the ankle. And trauma may lead to ankle arthritis not only because of direct cartilage damage but also structural changes that lead to biomechanical abnormalities. Okay. The symmetry in size and orientation of the lateral and medial facets of the ankle joint contribute to changes in the ankle mortise that occur during ankle dorsiflexion. The lateral facet is substantially larger than the medial facet and its surface is oriented slightly oblique to the medial facet. So some of the studies have been done on this thing, that is, Inman and Mann proposed that the body of the talus can be brought off as a segment. Okay. Then segment of a cone here, segment of a cone lying on its side with its base directed laterally. So this is the base directed laterally. The cone should be visualized as truncated or cut off on either end at slightly different angles. The asymmetry in size, here the asymmetry in size and orientation of the facets means that the distal fibula moving on the larger lateral facet of the talus may undergo greater displacement and than the tibial malleolus as the tibia and fibula move together during dorsiflexion. Okay, the greater arc of motion for the fibular malleolus than for the tibial malleolus results in superior inferior motion and medial lateral rotation of the fibula that requires mobility of the fibula at both the proximal and the distal tibiofibular joints. So any changes in the proximal tibiofibular joint also shows some changes in the distal tibiofibular joint. If any minor change in the distal tibiofibular joint will shows more effect on the proximal tibiofibular facet, because the proximal one is a synovial joint whereas the distal one is a syndesmosis. That means the distal one is least movable when compared to the proximal. So even a small movement which occurs at the distal tibiofibular joint leads to variation in the movement in the proximal thing. And also this ankle dorsiflexion and plantar flexion movements are limited primarily by the soft tissues restrictions and also active or passive tension in the triceps surae, that is gastrocnemius soleus muscles, is the primary limitations for dorsiflexion. Okay, ankle dorsiflexion is limited by soleus and posterior talocrural joint capsule when the knee is flexed. Tension in the tibialis anterior and extensor hallucis longus and extensor digitorum longus muscles is the primary limit for plantar flexion. Okay, so the most important function of collateral ligaments appears to be in minimizing side-to-side movement or rotation of the mortise on the talus. The ligaments are assisted in that function by the muscles that pass on either side of the ankle. Okay, so these are all about the ankle joint function. In the next session, we are going to discuss about subtalar joint. Thank you.